Dr. David Spiegel, welcome to the Mindset Advantage podcast.
Thank you, DJ. I'm happy to be here.
Yeah, I'm happy to learn from you today. We're going after a topic that I haven't yet discussed with the guest. 5 years of doing this podcast, Dr. Spiegel, and this is the first time, and I'm so eager and curious to learn everything there is to know, or close to, I guess, about hypnosis. I think the first
Sure.
place to start is let's just set the table. This is such a big topic. Can we just open up for the people a little bit of a 101? What is hypnosis?
DJ, hypnosis is a state of highly focused attention. It's like the experience that many people, but not all, have had of getting so caught up in a good movie that you forget you're watching the movie and you enter the imagined world. So you're narrowing your focus of attention. I often use in my talks a visual of a skier going down a steep slope. And one of the things that's so refreshing and fun about skiing is you better pay attention to your moves and where your knees are exerting pressure and how you're making your turns, or you're going to wind up on your butt. And so it's a natural way of shifting people into this highly focused state. In order to do that, you have to do two other things. You have to dissociate, put outside of conscious awareness things that are ordinarily in consciousness. Now, we tend to do that anyway. So right now, for example, you've got sensations in your bottom touching the chair you're sitting on, but hopefully that was not foremost in your awareness. If it was, we can stop the interview now. So our brains are very good at focusing in on some things and putting outside of awareness the array of other things that might distract you. And the third part is what scares people the most about hypnosis. It's been called suggestibility, and everybody's been to one of these dumb stage shows where, the football coach dances like a ballerina and all that. But there's a principle there that we call cognitive flexibility. And we actually found in a study we recently published that there is less perseveration among people who are highly hypnotizable. Now, perseveration simply means that you continue doing something the way you've been doing it without thinking much about whether you're doing it or not. That's often an advantage too. You just don't have to make choices all the time of what you're doing, but it can be a disadvantage too. You can get stuck in doing things, and good athletes know this, that they may have a bad habit about how they throw a ball or line up for a putt or something. That is more of a problem than a help. Sometimes what you've learned is good. We've discovered in hypnosis that people tend to disconnect more from regions of the brain that have to do with the usual ways of doing things. We call it the default mode network. And if you can disconnect, you're more cognitively flexible. And that's a tremendous opportunity. So the three things that hypnosis helps you to do are focus intently, dissociate from current sensations or thoughts that you don't want to pay attention to, and be cognitively flexible. Try out new things more than you would usually do it.
You mentioned the on-stage hypnotist. Talk to me a little about, I think that's a good way to go into, what are some of the myths about hypnosis that my audience needs to know?
Well, one of the myths is that it's a sign of mental weakness or vulnerability. We call it a myth conception about hypnosis. It doesn't mean that anybody can make you do anything they want you to do anytime. It is a time, and if you're worried about undue influence, think about the fact that 70% of Republicans think Trump won the election. We are, as human beings, we're social creatures. We have possibilities for being misled by people that tell us things, and we tend to judge and evaluate, and sometimes we are misled, sometimes we aren't. Hypnosis is a state in which you're less likely at the time to judge it. So, for example, if you get so caught up in a good movie that you forget you're watching a movie, you may later on think, actually the premise of that movie was kind of dumb and the acting wasn't great and all that. But at the time, you were in it. And so that's the issue here. It's not that you can't judge and evaluate. Your brain doesn't just turn off, but you're giving it a chance. And that's a good way to learn something new. You may have a coach that's telling you, hold the bat differently. And at first you think, hell, I've done this all my life. What are you talking about? But then you suspend disbelief the way people do in plays, and you try it, and then you say, hey, you know what? That actually worked a little. My balance was different. I was leaning forward more. I was better able to make contact with the ball. But you have to kind of let go of your older ways of thinking about it. So a certain amount of learning and changing has to do with the ability to suspend judgment and try out something new that you ordinarily would have rejected. And
Mhm.
that's one of the things that hypnosis helps with. So what is often portrayed as a problem or a vulnerability is actually an opportunity.
Love that. You also talk about, I think about in high school, we had I don't know what it was, like an all night show, and we have a hypnotist come in and, they go up and do stupid stuff. And from the outside, it looks like that the contestants or the participants rather are losing control. And your quote says, people think being hypnotized means losing control. It's not, it means gaining control. So that would be probably what I would think is the big myth. Can we
Right.
dissect what it means between losing control and actually you're gaining control, Dr. Spiegel?
Well, sure, DJ. The real issue here is that hypnosis is not something that I project onto someone else. It's a capacity that people have to a certain degree. About 2/3 of adults are at least somewhat hypnotizable. About 15 to 20% are extremely hypnotizable. And if you're not hypnotizable, the greatest hypnotist in the world can't make you be hypnotized. So what it really is I'm identifying and helping you to use whatever hypnotic capacity you have. If you've got it, let me tell you, you've been using it, you just don't realize it.
Mm.
So you are the kind of person that is more open to new possibilities and new ways of approaching things, who really get so caught up in a movie that you forget you're watching the movie. Whereas other people say, I've never had that. I don't know what you're talking about. So it's fundamentally, the ability to experience the hypnotic state rests with the person who's doing it, not with the person who's inducing it. And, we've now used in our Reveri interactive hypnosis app, hypnosis with about 300,000 people. So that's why I'm so tired every night. I've been doing it and some people respond tremendously, some don't. But it's helping to identify and teach people how to use an ability they have anyway. It's not something that I project onto them. And so it's your ability. Our major evolutionary advantage is this 3-pound organ on the top of our bodies, our brains. We're not the biggest, we're not the strongest, we're not the fastest creatures on the planet, but we have this ability to evaluate, judge, modulate our responses to situations. And the thing about it is there's tremendous ability in the brain, but it doesn't come with a user's manual, So it means that there are a lot of abilities we have that we don't take full advantage of. And one of them is this hypnotic capacity, the capacity to focus attention, to put outside of awareness things you don't need to pay attention to at that moment, and to be cognitively flexible about what you're doing. So it's an unexplored, underdeveloped ability. It's like a gold mine that you haven't discovered yet because you didn't look there.
As this conversation goes on, I'm trying to parlay between your field and my field. And one of the things I'm picking up on is you first have to be open-minded. And Carol Dweck obviously wrote a fantastic book of mindset and talks about growth mindset versus fixed mindset. And growth is all about being open-minded. I mean, it's really mindset 101. And so as we're kind of going back and forth here, what I'm hearing you say is that in order to be hypnotized or to use your mindset is as an advantage, the first step needs to be open-mindedness. Am I following you correctly?
Sure, you got to be open to the possibility, although frankly, some people are using it and they don't know it. So they may have these experiences and wonder why, I have patients who I identify as being highly hypnotizable who said, I never used Novocaine when I was in the dentist's office. I just didn't want it. I didn't like it. And I just, went to some, mountain lake and floated in the lake while the dentist was doing whatever he was doing. And the dentist seemed to have more pain than I did, So there are people who would never say they were ever hypnotized who use that hypnotic capacity anyway. And there are many good athletes who get into, like the flow state. There are, quarterbacks who say, I know when I let go of the ball, whether it's going to be caught or not, They have that sense of engagement. That's a self-hypnotic state that they just don't call that. But you're absolutely right. There are a lot of people, a lot of good athletes who can benefit from it a lot more by using it more. I was asked by Richard Quick of the Stanford women's swimming team to help him because he found that a lot of his swimmers were swimming better in practice than they were in meets, which, if you think about it, swimming is not a contact sport. It's not like water polo. And so it really doesn't matter what the woman in the next lane is doing. But they were so worried about how they were doing in comparison that it was throwing them off their best swim. They were not in the rhythm they would do for that. So we practiced swimming their best swim using self-hypnosis, and to prepare themselves for the meet by focusing on what they were doing and forgetting about what the women in the next lanes were doing. And they started swimming better. So it's a matter of using a natural ability people have to focus on what's important and get rid of the distractions. We people who use hypnosis say the worst thing you can say to somebody is don't think about purple elephants. Right? So part of it is the strategy. You get yourself to focus on what you're for. And that's a lot like mindset. The people who do mindset for cancer patients and other things want people to focus on what they want, how they want to live their life in the face of what they're facing, and do it as well as they can, not just focus on the threat that is lurking out there.
Take me back to that swim team. That's so interesting to me. What, if you don't mind sharing, what did that process look like, Dr. Spiegel? What'd you do?
I just had them look up, close their eyes, take a deep breath, imagine themselves floating in the pool, getting into the pool, and just focusing on the experience, the inner experience of swimming their best race. So what do you focus on? Are you counting strokes? Are you having some sense of the time? Are you figuring when you have to make your turn and how to make it? But focusing on all the things that help you to do your best and that have helped you to do your best in the past, rather than on your anxiety about what it'll mean if they come in second and that awesome swimmer from the other team in the next lane and all that. Just choose what you want to focus on. Choose on your relationship to your body. What are you doing within your body that helps your body do its best? That's what you want to be paying attention to, not whatever the person next to you is doing.
So, Dr. Spiegel, I have 7 tactical skills for an elevated mindset. And one of my skills is visualization. And I help people and kids and athletes think about, before a game, about the best case scenarios and sometimes the worst case scenarios, so they can see it in their mind before it happens. I believe in the saying that everything happens twice, first in your mind and then in reality. How is hypnosis different from what I'm doing with visualization? Is there a crossover? Are they very different? Educate me.
Well, there's two things. There's the hypnotic state and then the uses to which you put it. I'd say it's very similar to what you're doing, particularly for people who are at least moderately hypnotizable. But I'd say a lot of it is the capacity to not just think about, but to have the experience of actually doing the swimming and doing it well. And so you want them to prepare themselves in practice mentally for what they're going to be doing physically when they get in the water. So everything that happens during the meet is just a recreation of what you've already prepared yourself to do, the parts of it you can control. And one example is among the many stupid, awful things Vladimir Putin has been doing, and God knows it's horrifying now, is he insisted that the Sochi Winter Olympics occurred there despite the fact they had virtually no snow that year. And so the athletes were only allowed to do one practice run before they had to do the competitive run. And that's hard. That's bad. So you know what? Bode Miller and the other skiers would get up to the top of the run, stand there, look up, close their eyes, and practice every move they were going to make on the run, even though they couldn't actually run it. And so the idea was they were mentally programming themselves, just like what you talk about, but doing it and they didn't call it hypnosis. I'm calling it hypnosis, but they were doing exactly what I would have told them to do if I were there coaching them on it. So you just do them be really comfortable with the detail of the mental experience before you actually engage in the physical experience. And another example is there are, these, athletes that are doing parallel bars and, flips, and all that stuff in the Olympics when they do get injured, unfortunately. And there have been experiences where somebody who dislocated a shoulder or something and has to wait out a couple of months before they can recompete will actually go to the gym every day and mentally do what they would have done physically.
Wow.
And those people recover much faster and
Wow.
wind up performing better than the people who don't. That there's some, that, you know, you think if you can't do the physical part, obviously that's the ideal thing, is to do the physical training. But you know what? You can still do the mental training. And that's another kind. They didn't call it self-hypnosis either. I do. But the more intense and the more detailed the mental experiences of what the physical event is, the more likely you are to do well with it.
There's more correlation or parlays there than I thought. That's so cool. Another piece that I've learned from a mentor of mine is through watching film. So the football team watches film after a game, and instead of just watching it to watch, a strategy I've learned is they watch the film, they watch a play. It didn't go well. Instead of ending on a bad play, the coach will have them close their eyes and see it going in a positive way. So if the kid went right, they're supposed to go left. You're going to close your eyes and visualize yourself doing it the right way. What are your thoughts on something like that as a strategy?
Excellent, excellent idea. And I mean, he's doing hypnosis, you know, he's having them close their eyes, not simply think about it would have been better to go left instead of right, but experience doing that. So you're now setting up all the neural machinery to get your brain to tell your body to do what you want it to do, so that they're then triggered the next time they actually are in the play, exactly what all the moves are to do it right. It feels right. It's not simply they think about, oh yeah, I should go left. It's, what does it feel like for me to do that, and all the things that will unfold when you do that. That's a hypnotic-like way of experiencing, and not simply a cognitive way of thinking that's what I should do.
Because there is a difference. There's a big difference between I tell you what to do, okay, write it down or whatever, between, okay, let's take 10 more seconds for you to visually see it. There is a difference between those two.
Oh, absolutely, absolutely. Because you're setting up, you're kind of rewiring what the set of mental associations are that will get your body to do what you want it to do. And so that's absolutely right. You're having a partial intense experience of actually doing it.
Earlier, you mentioned a person going through having Novocaine on the dentist chair, and they went into a lake. Walk me through what was that?
So here's the deal. The strain and pain lies mainly in the brain. So, you know, we tend to think of pain as purely a physical experience. It is not. And, you know, there are football players who, you know, get through a game, and the coach looks at their right ankle and says, God, that's 3 times the size it ought to be. You must have sprained or broken your ankle. And they don't notice it. You know, they're in there, they want to play, they do play. And so part of pain is the brain interpreting the signals that are coming in as important and potentially dangerous. Now, you know, from an evolutionary point of view, one of our major advantages is our capacity to modulate pain perception. Because if you think about it, we're not that big, we're not that fast, we're not that strong, we don't smell as well as other animals, we don't hear as well as other animals. So one of the things that gave us survival potential is a capacity to evade predators. Now, the difference between predator and prey animals is that predator animals, like us, have 2 eyes in the front of our heads. So that means we are very good at specific detection of a target, right? Because with the 2 eyes and the slightly different images from each eye, you can calculate how far away it is. You can see movement very well. Think about prey animals like deer. All right, they don't have parallel vision like that. They have eyes on the side of their heads. So they have a better view of the range of 180 or more degrees of something might be moving there to get me. But they're not very good at detecting prey, because all they have to detect is vegetables, you know, is trees and grass. And so the capacity to evade detection has survival value. And that means that the ability, if you're hurt or scared, to not move and twitch and run around will make it less likely that a predator will detect you, especially if you've been hurt. And so I think part of our survival has been the ability to inhibit activity, inhibit pain perception in the service of just not getting killed. And you know, soldiers will tell you that too. You know, you don't want to attract attention from an enemy. So the brain actually processes pain signals in a way that allows you to determine, oh my God, I just broke my ankle or broke my arm or something, I better get help. Or I'm having crushing substernal chest pain, I better call an ambulance and get to an ER, I'm having a heart attack. Versus many situations where the pain isn't novel, it's not that bad, or even if it is bad, you don't want to be paying attention to it. You just want to get out of a bad situation safely. And so we've done studies with EEG and functional magnetic resonance imaging, showing, for example, we had a bunch of Stanford students. I'd give them a shock to their wrist repeatedly, and we'd record the electrical evoked response to the shock. And there are 3 patterns early within a half a second of stimuli like this, P100, P300, and P5. And the interesting thing is that you can take the same shock and tell a student your hand in hypnosis is cool, tingling, and numb. The P100 disappears. So this means that within a tenth of a second, the brain has decided this isn't worth paying attention to, and it doesn't propagate the signal. The P300, which is usually a situation in which if it's important to you or it's novel and surprising, it'll be bigger. Well, that's half as big as it was in the standard condition where you just give them the shock. There are studies that show using MRI that if you hypnotize someone and say that you're floating in a bath, a lake, or a hot tub, the warm or cool tingling numbness, you reduce activity in a part of the brain, the somatosensory cortex, that helps you interpret this as pain. You can reduce or eliminate that signal with a hypnotic instruction. If you tell them something different, you just use a different hypnotic image, well, it's there, but it won't bother you very much, which is sort of the way people tend to feel on opioids. You then get reduced pain sensation, but it's now in the salience network, the anterior cingulate cortex, which is a part of our, salience response network that tells us that this is threatening or this is dangerous, you better pay attention. It's what social media uses to distract you from whatever you've been reading by saying, do you know that there's a guy out in your neighborhood who's doing this? So you suddenly go and respond to that. You turn down activity in that region. So the brain is very good at turning down, using techniques like hypnosis, response to signals that otherwise would be interpreted as pain. So literally, you can reduce the strain and pain using hypnosis, and that's been done. We've done studies in people undergoing invasive procedures with arterial cut downs. We can reduce their pain by 80% on patients who use half the pain medication. They can push a button and inject opioids. They have 80% reduction in pain. They aren't anxious at all, whereas the standard care patients are very anxious. They have fewer complications. So the brain has a remarkable ability. And in fact, that's a good coach will know that sometimes you have to tell people you can no longer go out on the field because you're hurt and they want to go anyway. They're down regulating the amount of pain they feel. That has an advantage, but it's got a disadvantage. You can undertake risk you shouldn't. So pain is a modulatable experience that hypnosis can be very helpful with.
That's fascinating. I got your quote pulled up here. It says, you can literally change how much pain you feel by changing the way you focus on it. I'd want to ask the last 3 words. Is it the way you focus on it or focus on something else?
Good question. And it's more often focusing on something else. Yeah, if I tell you this won't, you know what the doctor would always say, this won't hurt. You say, oh, great. Yeah, sure. But if you say, there was a pediatrician I knew who was an experienced hypnotist, and what he would say is, right now, I want you to pay attention to your belly button. And he'd tickle the kid's belly button. Meanwhile, he's giving him a shot, and the kid doesn't even notice the shot. You're not saying this won't hurt. You're saying, boy, your belly button feels good. And bingo, there you go. So yes, it's to focus on what you're for, not what you're against.
So a lot of what we're talking about here is focus and distraction. I think if somebody were to ask me, what is the mental game? In a short sentence for me, for athletes, it's focusing on what you need to focus on right here and right now. Focus on the controllables, not the outcome, the next play, everything that you need to focus on, you're completely dialed in. The opposite of that is obviously distraction. We live in a world right now where it's hard to be focused, right? We see
Right.
social media, just the advertisements, TV, even movies now are cutting scenes quicker and quicker and quicker. I'm just curious, and we can take this wherever you want to, but for athletes out there who are looking to get a competitive edge, Dr. Spiegel, what advice do you have to help them gain a higher level of focus? Sometimes as coaches, I think we're battling an uphill battle with how easy that it is to be on your phone to get distracted. How can we help to apply more focus? What are your thoughts?
Uh, excuse me one sec, sorry. Um, that's how I deal with focus. I say, can I call you later? uh, uh, there are, I'd say for a good athlete, there are kind of three stages of managing focus. One is preparation focus. So you say, okay, I'm going to prepare for this event by focusing my attention on specific areas of my performance that I'm most concerned about. I also want to focus on the way I deal in contact sports, certainly in intensely competitive sports. I want to focus on using my opponent as a kind of a coach. That I want to see it not as this guy's trying to stop me and I got to get around it, but he's teaching me what an opponent will do to try and keep me from playing my game. So I want to take his moves as something I can learn from. I'm learning what his style is and what are his strengths and what are his weaknesses so that I can play him better. So he's a coach for me. So you try and use it as an opportunity, not an opposition. And so I prepare playing my game the best way I can, but also preparing to use the opposition as an occasion to learn. And so that's a way of getting a better mindset and picturing how you'll do it. During the game itself, and this kind of step two is during the game itself, what am I doing? How do I want to play my best game? And I want to get engaged in how I'm relating to my body, because most of what you're doing is how you're managing your body, how your body's responding, and seeing what your body's limits are, but also what its possibilities are. So during the game, you just want to be in the flow of the game. You don't want to be, as you mentioned, you don't want to be worried about the outcome, what the score is going to be, what it means if we win this and get on to the next thing. We want to do it as a way of being the best we can in a game. I still remember with pride the Stanford football team, which has been a very good team, not always, but has been. But there was one game where it was very close. It was basically a tie, and they had a freshman kicker who got called on at about a 35-yard line. It was a tough field goal, and he missed it. And the players afterwards came around and patted him on the back and said, look, if we had been playing better, you wouldn't have been in this position. This was a tough thing for you. And I was so proud of them that they could even take a situation where they had a painful loss. And instead, they did it as, playing with my pals, and we're all a part of this. And I just thought that's a beautiful example of playing the game well and doing things that continue to strengthen the team rather than trying to blame some kid who was doing the best he could in a very tough situation. So you want to structure the game itself in terms of what's the best playing experience I can have here. And then the third part is afterwards, reliving it and saying, relive what you did well, relive what you could do better, but take some time to debrief. I learned this in college, where one of the few useful things, they had an education program that you could be a part of, have learning better things. And they said there's a golden few minutes after you have read a difficult text, for example, and that is just take a few moments to either think about or write down what are the key things you learned from this. You tend to think, thank God I read the damn chapter, I'm done, I'm going somewhere else. No, take just a couple of minutes to consolidate what it meant to you, what you learned, what's new and different. That's really precious time. So and again, this is where self-hypnosis can be very helpful, is to focus on consolidating how you've changed, what you've learned that's new, what's different that you didn't know an hour ago. And so those three steps can be very helpful, and self-hypnosis can be very helpful. You get your body floating safe and comfortable, so you're in a physical situation that allows you to concentrate intently and then use that to consolidate what you've learned.
I would imagine there's a optimal state that we should be in for visualization or for hypnosis. I could imagine that right after a third down play where you are exhausted or stressed, that's probably not the time, or maybe it's harder to get into a deeper visualization state. Is there a more optimal time? I'm thinking, Dr. Spiegel, before a game, calm before the storm, a little more calmer. I can probably
Right.
enter into that state a little bit more
Right.
than I just got off the court. Give me a minute. Is there,
Yeah.
talk to me about, is there an optimal state to get into some of these deeper thoughts?
Well, yeah, I think it's nice if you have a little bit of time. But you know what? I even think in football, the huddle can be a place like that, where you're taking a few seconds, 15, 20 seconds to reconnect with the other players and your teammates and just kind of mentally program who's doing what and when am I doing it. And so just sort of say, okay, it's not just calling a play, but it's preparing yourself and your body to carry out that play. And so I would view even brief times like that, or certainly if you're on the sidelines while something else is going on, instead of just watching the play, use it as a time to imagine that you're somewhere safe and comfortable. Your body's feeling comfortable and relaxed, and you're picturing what you're going to do when you get the chance to do it. So, it's one thing to just watch what your buddies are doing. It's another thing to use the same time to prepare yourself for what you're going to do next. Playing basketball, so the coach took you out. Don't worry about that. Use it as an opportunity to say, when he puts me back in, here's what I'm going to do. And I realized that I got something going with one of my teammates, and I'll feed to him and he'll feed to me. I mean, you look at Steph Curry. I mean, the guy, of course, is always just cool. But what's amazing is, despite what an incredible offensive power he is, he's great at setting up his teammates. It's never him having to do it. So he's thinking, I'm looking for opportunities, not just to take a shot from, 30 yards away, but also how to set up my players. So he's choosing that, and I'm sure preparing himself to do it either way. I'll take that shot if I can, but I'm also looking for other opportunities. So the more kind of quick mental rehearsal you can do, the better you're likely to be. Because when you get to that situation, when the fluidity of the play, suddenly there's a pattern there, and you think, okay, this is my chance to do it. But mental preparation for that really helps.
And as we're talking about in-game tactics, something I learned I don't know why that's coming to me right now, but a coach when I was little talked about when you go up to the free throw line before the ref passes you the ball, close your eyes and just see the ball go through the hoop. Then open your eyes, take the ball from the ref and shoot. Now that I'm thinking about this, Dr. Spiegel, that was some hypnosis right there, wasn't it?
You bet. You bet. He's saying, have the mental experience of what you're going to be doing mentally and physically. And so it's, again, picture what you're for. That's a great suggestion. Not what you're done. Oh my God, what does it mean if I miss? That's a good way to screw yourself up. Instead, you want to be in control. And that's, again, where it irritates me so much that people see hypnosis as losing control. It's gaining control. You're saying the part of the game you can control is planning for what it is you're going to do when you have the opportunity to do it. And so you're saying, what I want to think about is doing what I want to do, not what I have to. There's T.Z. Suzuki was a Zen master who wrote a book called Zen and the Art of Archery. And archery was a big deal in Japan. And he would talk about the preparation for it. But what he says, where people make the biggest mistake is focusing on the goal rather than the process. And he said, what matters is your relationship with the bow and arrow. And if that is correct, you will hit the target. But if you're focusing on the target, you're disconnecting yourself from what's going to make you do that. And so the same is true. You're picturing the ball going through. I want to picture what I need to do between me and the ball and my body to prepare to propel it in the way it should go. And that's where Steph Curry is just miraculous, that he's so in touch with his body, even with guys all around him, that he's got his body connected to what he needs to do for the right outcome to happen. And that's where athletes can really gain an advantage.
I love that. One of your quotes also says, the goal of hypnosis is not to just get hypnotized, it's to use this state to deal with the problem. And as we kind of turn the page a little bit away from sports, I think when people first hear hypnosis, they probably think of maybe the onstage stuff, but then second, they're probably thinking of things like sleep, chronic pain, which you already touched on, but trauma, addiction, some of those, maybe I would argue bigger items. Talk to me a
Right.
little bit about what does that look like, Dr. Spiegel? You're not just, it's not just get hypnotized, but I want to focus on the problem. And if we focus on those big ones, let's just say sleep, trauma, addiction. If you have another one to add, dive into
Sure.
that for me.
Sure. Well, we use, we've developed this self hypnosis, interactive self hypnosis app called Reveri, Reveri. You can download it from the App Store or Google Play if you have an Android. And there, it's interactive. You get to hear my mellifluous voice helping you with a series of problems like the ones you've talked about. And so for sleep, for example, and this has to do with stress and focus as well, part of the problem in the way we handle stressors, and it's a problem when we're trying to go to sleep, is that we tend to facilitate rather than inhibit that connection between something that is stressing you and the way your body reacts to it. So our typical reaction to a threat is fight or flee. It's sympathetic arousal. Increase your heart rate, increase your blood pressure, tense your muscles, you start to sweat. And then you notice that and you say, oh my God, this must be really bad. And so what happens is you tense up some more, your brain thinks, oh, this is really bad. And it's like a snowball rolling downhill. And so what I tell people to do if they're trying to sleep or they're dealing with stress is the first thing you do is the thing you actually control, and that is how your body reacts. So just go into hypnosis and imagine your body is floating in a bath, a lake, a hot tub, or floating in space. And just allow your body to feel more comfortable by affiliating with a physical image that tends to induce comfort and relaxation rather than stress. So before you do anything about the stressor, get your body, that's the thing about stress, you can actually immediately do something about whatever the stressor is. And, people will say that, golfers, with that final putt, you're not focusing, oh my God, what if I miss this? They're losing muscle control. So you just say you're enjoying this sense of connection with your body. And then if you can then picture, for example, if you're trying to go to sleep, what you're stressed about is if you're watching a home movie, but at some distance from your body. So you get your body comfortable. Or if you're trying to deal with a stressor, you picture on a split screen the stressor on one side with your body floating and comfortable, and then use the right side as your problem-solving screen, your brainstorming screen. Well, what might I do about that? And the minute you begin to think of a strategy, even if it isn't a very good one, you're doing something. You're not passive, you're active, but mentally, not physically. So you're using your brain to figure out how you might deal with the stressor on the left. Or if you're just trying to get to sleep, you don't want to solve the problem. You just don't want the thoughts about the problem to disrupt your capacity to go to sleep. So your body's floating in a hot tub. Whatever that thing is you're worrying about, you'll deal with it better in the morning than deal with it now. So project it outside. In the same way for pain, part of why pain escalates is you think, oh my God, what does it mean? I treat advanced cancer patients all the time. And the pain bothers them in part, not because this little pain in their chest is necessarily that bad, but they think it means there's a new metastasis and the cancer is spreading. And so they pay more attention to it, not less. So I just say, imagine you're taking a warm bath. Whatever it is you do that actually reduces the pain physically, do it in your imagination now. Warmth or cool, tingling, numbness, and just allow your body to float and filter the hurt out of the pain. You reinterpret the physical sensation as something that isn't that threatening, and your body can feel better. And I instruct people on Reveri how to do that, to filter the hurt out of the pain. It may be there, but it won't bother them so much. I had one patient, a lovely young woman, 7 months pregnant with really bad lower back disease. They couldn't give her pain meds. As the baby grew, of course, the pain got worse and worse. And they surgically implanted a nerve stimulator. That didn't help. And so she's in my office and I'm saying, you're floating in a hot tub. Warm, tingling numbness filtered the hurt out of the pain. And her pain went from 7 out of 10 to 3 out of 10. She opened her eyes and she looked angry. And I said, what's the matter? She said, "Why were you the last doctor I got sent to instead of the first?" And so, just learning that you have this ability that is underutilized. If your brain can make the pain feel worse, it can also make it feel better. So those are the kinds of things we teach people to use with Reveri. And we have a website, www.reveri.com, or you can download the apps and just try it and see what it feels like. But people have a tremendous ability to help themselves that they don't give themselves enough credit for.
Fascinating. Dr. Spiegel, tell me a little bit more about, as we dive into that, what about the words people are saying? So sometimes when I can't go to sleep, it doesn't happen very often, but when it does, and I'm up later than I want and I'm laying in bed, I'll say things like, the body gets what the body needs. The body gets what the body, whatever I get is whatever I get. If I get 3 hours, I get 3 hours. If I get 8 hours, hey, great. But the body gets what the body needs. And sometimes people with chronic pain, they'll say things like, well, I just have chronic pain. This is just par for the course. They kind of put those expectations out. I'm a big believer in self-talk and how it manifests in our body. Talk to me about, how does that parlay with some of the things that we're talking about?
I absolutely agree. Hypnosis simply amplifies that very wise thought that you have, because if you're saying the body gets what the body needs, what you're telling yourself is this is a chronic, not an acute issue. Our brain is trained. We process tons of information all the time, but most of it outside of conscious awareness. And there's a part of the brain called the anterior cingulate cortex, part of the salience network. And it's a context matcher. It helps you decide, is this something new that I really got to be scared about, or is it just some old problem that I have dealt with for years, like you're saying? And in hypnosis, we've shown, using functional magnetic resonance imaging, that when you go into a state of hypnosis, you turn down activity in that region. So the part of your brain that sets off the fire alarm, or if you hear a loud noise, you say, oh my God, it's a gunshot, what's happening? Or it's just, the neighbor clanking around his kitchen or something. You're turning down that arousal, which is necessary sometimes when you're processing threat, but most of the time it isn't. So you're saying, whatever this is, it's nothing new. I don't have to worry about it now. It's just there. It's an annoyance, but it's not a threat. And hypnosis helps you to do that, to just turn down your response to the signal, just as you do when you say the body gets what the body needs. The worst thing you can do when you're trying to go to sleep is to worry about getting to sleep, right? Because in sleep, there's a shift from sympathetic arousal, fight or flight, increased heart rate or blood pressure. What you need to go to sleep is to turn off the sympathetic nervous system and turn on the parasympathetic. That's the self-soothing part of your nervous system. And that is the context in which you can actually go to sleep. And we know from sleep studies that you have to have parasympathetic dominance to be asleep. And what happens if there's a loud noise or a fire alarm at 3 a.m. is suddenly your sympathetic nervous system goes on and you're awake. And so the capacity to self-soothe, which hypnosis can facilitate, is part of the capacity to get to sleep or to stay asleep. And we have, our most popular app is the sleep app, either to get to sleep or to stay asleep. And, we do these pre-post tests. We ask people, how's your pain now? We're finding, and then how is it after 10 minutes of self-hypnosis? And it gets generally reduced about 35%. Stress levels. In one study we did with 15,000 of our users, stress levels reduced by 35%, pre and post, just within 10 minutes. So you will know right away whether it's likely to help you or not. We weren't getting much response from people with the sleep app, much less than we did with stress and pain. And at first I was concerned about that, what's going on. So we started interacting with our users and said, what's going on? They said, I don't want to tell you how sleepy I am. I just want to go to sleep. So they were not complying with the feedback, but they were going to sleep. And so you're absolutely right that the capacity to turn off the sympathetic arousal, the fight or flight response, and allow the sense of comfort and relaxation that comes with parasympathetic activity is the context that allows us to go to sleep and stay asleep.
And the words we say are so important. I've had the opportunity to talk with the Expectation Effect author and some other people that are physicians, and something that they've pulled out is that they believe that how you talk about aging can play a tremendous role in how long you're alive on this earth. And the number that they came up with was 7.5 years. So the way you talk about aging can extend your life up to 7.5 years. So I'm curious, as you're working with these cancer patients, right? And they're in a very difficult spot, and we're trying to get them to have a better mindset, trying to get them out of pain or have less pain or turn it down. But if they aren't talking about it in a productive way, it's kind of a self-defeating prophecy there. They're not going to be able to break through it. I mean, hypnosis probably only takes you so far. For 10 minutes, I can get you in a great state. Then the rest of the day, you're like, yeah, I have cancer. This sucks. My life is this and this and this. It's kind of tough, isn't it?
It is, DJ, but we found some surprising things. Back in the 1970s, we started a randomized clinical trial of women with metastatic breast cancer. Now, and this was years ago when the outcome was not as good as it is now. And we randomized 50 of them to weekly support groups. And we were warned, including by some oncologists, that we would demoralize them. If anything, they'd die sooner, they would get worse, because they would see other women in the group dying of the same disease that they have. The other 36 women had standard care, but they were randomized. So there was no difference between them, except that 50 of them got our weekly support groups. And they were looking death right in the eye. They would see other members of the group die, and they would grieve the losses. But one woman said, being in a group is like looking into the Grand Canyon when you're afraid of heights. If you fell down, it would be a disaster, but you feel better about yourself because you're able to look. I can't say I feel serene, but I can look at it. They discovered that just feeling connected with other people who were going through the same thing that they were helped them. And they felt better because they could help their friends. They could see in other people what they couldn't see in themselves. This is a brave, strong woman who's trying to live her life as well as she can, as long as she can. And, the idea that death is not a novel concept to a cancer patient. Half of all people diagnosed with cancer will live to die of something else, but everybody diagnosed with it thinks it's going to kill them. And so they put it in perspective, and they gained a sense of strength for being able to face the worst and live as well as they could, as long as they could. We found at the end of the initial year that the women in our support group were half as anxious and depressed as the control patients.
Wow.
They had half the pain because they would do self-hypnosis to manage the pain. This could be another metastasis, but it probably isn't. I can filter the hurt out of the pain. And they felt better as the pain felt better. It didn't seem like doom was right in front of them. And the biggest surprise was about 7 years later, I decided to find out what happened to the women in the groups. And the 50 women in the treatment condition lived an average of 18 months longer than the control group.
Wow.
And we published that in the Lancet in 1989. It got a lot of attention. And we've now done a meta-analysis of studies of emotional support for cancer patients. And we found that all in all, those assigned to support groups live significantly longer than those who don't. There was a study in the Journal of Clinical Oncology studying 600,000 cancer survivors in the US over a 5-year period. This is out of Dana-Farber Cancer Center, that women who were married lived on average 4 months longer than women who were not married. Men and women, actually. Men did better than women, actually. Having a woman supporting you was better for you than having a man supporting you, but there was still an advantage. And this was in a huge sample, and it led them to note in the abstract of the paper in the Journal of Clinical Oncology that marital status gave you as big a survival advantage as the overall effect of chemotherapy.
Wow.
So the answer to your very good question is yes, it makes a difference. And even if you're facing things that are very difficult, just having the strength to face them and figure out how you're going to deal with it is more of an advantage than a disadvantage.
Very cool. We're getting close to time here, but there's just one more topic I wanted to hear about was addiction. I think this is another area that people can probably come to hypnosis about. And I think the first thing that comes to my mind is smoking addiction, maybe.
Right.
Talk to me a little bit about where does addiction play a role in hypnosis?
Hypnosis can be very helpful because you can use it to intensely focus on what you're for rather than what you're against. So if people focus on craving and all that stuff, I remember there were signs on the freeway years ago that said, "Are you dying for a smoke?" And people would think, "Yeah, actually I am." I think, instead, what we teach people to do with hypnosis for smoking, for example, is to focus on 3 things. Get your body floating and comfortable and tell yourself, 1, for my body, smoking's a poison. Not for me, for my body. 2, I need my body to live. And 3, I owe my body respect and protection. We get them to think of their body as if it were an infant. Would you ever put tar and nicotine into the lungs of your baby? Hell no. Your pet, your dog or your cat, never. So instead, people think, well, I'm doing it to myself. Well, you are, but you can stop smoking, but it may have been too late for your body. So focus instead of on the power of the craving, instead on the power of your sense of responsibility to respect and protect a trusting, innocent creature that depends on you. Your body is as dependent on you as your baby or your dog is, but you don't think of it that way. So focus on your sense of responsibility to respect and protect your body, and then make a choice. If you don't care, smoke. If you do, protect your body from that smoke. And we found in long-term studies that 1 out of 5 people who are just taught one session of doing the self-hypnosis quit smoking. And we had one of our Reveri users who did it, who said, she wrote back, we asked, what did you think of the hypnosis for smoking control? She said, this is some kind of crazy ass voodoo shit. She said, she said, you know, but I mean that in a good way. She said, and she said, I didn't even want to stop smoking. And I just lit up a cigarette and went, who needs this? She's going around getting her friends to stop smoking now, and they can't believe it. She said, you've been smoking for decades. So if you focus on what you're for, not what you're against, and use hypnosis, you can just shift gears. It gets back to what I said earlier about, you know, giving up your old ways of thinking about things. It's that cognitive flexibility. I never thought of it this way. I thought of it as if I've got the craving, I've got to do it. We all have cravings we don't act on because we're not willing to pay the price. This is just another one of those. So you focus on what you're for, and it can make a big difference in problems like smoking.
Huge life lesson there. I think a lot of different layers. Focus on what you're for, not against. The swim team, focused on your best, not focus on what's around you. I think we all have the power and the choice in what we want to think about. Think about what's going to go well, not maybe about what's not going to go well. Let's put it into good terms.
That's exactly right. You got it, DJ. And
Cool.
The more intensely you're focusing, and the more you're in an altered mental state, where you're focusing intently, but putting outside your usual presumptions, your usual expectations about what will happen, you're open to suggesting new ones and affiliating with them.
This has been a great time, Dr. Spiegel. Thank you. You talked about the app. Just take another moment. How does it work? Where is it? The floor is yours.
Your bet. Thank you. So Reveri, Reveri, for those with iOS phones, you can download it from the App Store. Those with Androids from Google Play, download the app, try it. You get a week free use of it to see what it feels like to you. And there are apps for focus, enhancing focus, stress management, pain control, eating better, eating with respect for your body rather than fighting food, stopping smoking, dealing with alcohol problems, insomnia, getting to sleep or staying asleep. We're going to have a new one coming online about fear of flying and how to deal with that. It's interactive. So I give you some instructions and you hear my voice. I ask you, well, is your hand floating in the air? If you say yes, we go on to the next thing. If not, we help you with that step of the thing. So it's as much like the experience in my office as I could make it. Wow. And you can use it as many times as you want, whenever and wherever you want. I used to worry that it wouldn't be as good as what's happening in my office, but you know what? In some ways it's better. If you wake up in the middle of the night, I'm not going to be there to help you get back to sleep, but I will through the app. And so people are finding it can be very helpful, and it gives you the real feeling of interacting with me to learn to identify and use your ability. The other thing we have now is an integrated self-hypnosis hypnotizability app. So you can learn how hypnotizable you are just from interacting with the app, and then use the hypnosis differently depending on your degree of hypnotizability. So people are welcome to try it, www.reveri.com, or just download the Reveri app. And we hope it will be helpful to you.
Well, I'm downloading it right now. Awesome. I can't wait to get into it. Dr. Spiegel, this was a blast. Thank you for playing in my field a little bit with mental performance and sports. I really appreciate it. I just appreciate your time, man. This was fun.
Happy to do it. I enjoyed the game. So great to talk with you, DJ.